Hey guys, and welcome back. Listen, in this short video, I'm going to give you guys all a magic number. And this magic number is R53.83. So what does this mean? This is actually a number that's going to help you to get some of these functional medicine tests that are so valuable for getting insight into your health, your wellness, your longevity, paid for in the United States. Now, if you're from Canada, if you're from Great Britain, if you're from Australia, well, don't worry so much about the number, because the truth of the matter is that you guys all have a socialized medical plan and people get the healthcare. That's not the case in the United States. So what happens is in the US, basic laboratory testing is almost kind of like a door prize for just going in to see the doctor. I mean, your doctor will check a complete blood count, a complete metabolic panel, and maybe a lipid study. I mean, these studies will tell you that you're not dying, but other than that, they don't give a lot of insight into the steps you need to take to optimize your health, optimize your longevity, optimize your wellness. R53.83 is the code in the United States system that refers to fatigue. But I want to be really clear about this, because this specifically noted in the description said that this is a non-specific fatigue. It's not a fatigue associated with any known diagnosis, with cancer, autoimmunity, any known process. It's really basically saying that you're just feeling kind of tired. So what I'm going to do is, using the code R53.83, a non-specific code for fatigue, is give you the 4 most important functional tests that you can actually have your conventional doctor and your conventional American medical policy pay for. How cool is that? Okay, the first test that I'm recommending is what's known as an HSCRP, high sensitivity C-reactive protein. And what this is a marker of inflammation. And if God were to present himself to me and say, Dr. Resnick, I command thee, you can only order one test on your patients, I would order a high sensitivity C-reactive protein, because it gives such insight into the underlying inflammatory processes that are going on in the body. And really, at the end of the day, inflammation is the single key that ties together all aging, all pain, all disease, and all chronic processes. The next study that I would have done is a vitamin D level. I can tell you that around the world, we are all notoriously low in this important vitamin. But here's what's funny is it's not really a vitamin, it's really more like a steroid hormone. And what steroid hormones do is they travel to the nucleus of cells and actually instruct the DNA how to work. In fact, it's estimated between 5 and 12% of the DNA in a human is actually dependent on the signaling from vitamin D. So make sure that you know what your vitamin D level is, and then make adjustments appropriately to raise it up to a normal range. The third lab test that I would recommend is known as a homocysteine. And what this is it's a reflection of how well you do a process known as methylation. Now, methylation is a hot topic. So if you open any contemporary top-line journal, I mean Cell or Science or Nature, I can guarantee you that there is going to be an article in these journals regarding the methylation process. Why is this? Because methylation is really important for 3 main processes. One is detoxification. The next is the production of neurotransmitters. And the third is the activation, again, of our DNA. So know your methylation status by knowing your homocysteine. Because if your homocysteine is high, let's say it's higher than maybe a number of 10, then you're going to want to take some B vitamins, namely B6, B12, and B9, to begin to bring that down. I'll tell you on a personal note, I have a genetic polymorphism known as MTHFR that actually causes me to have slightly high homocysteine. I don't like that because it increases my risk of cardiovascular disease and Alzheimer's. So I take my B6, B12, and activated folate on a regular basis. Number 4 is know your thyroid status. Make sure, using the code R53.83, that you go to your doctor and ask to have a full thyroid panel. What is that? That's the TSH, thyroid stimulating hormone, and then markers of the free hormones, free T3 and free T4. And if your doc is feeling generous, make sure that they also add thyroid peroxidase and thyroglobulin. These are markers of autoimmunity, namely Hashimoto's. So many of the budget rate thyroid tests will give you TSH and maybe a total T4 or a T3 RUI. These aren't as valuable as a TSH, a free T3, and a free T4. So there you have it. These are 4 super important functional tests that will take you out of the doldrums of like, oh, let's just check your blood count and your chemistries and your lipids. That's not giving you any insight into some modifications that you can make in your diet, in your behaviors, in your supplementation, in your hormone management that's going to actually help you to live longer, better, and have a more energetic and untired life. As always, I'm making these videos to empower you guys to be the best stewards of your own healthcare, to use the tools that are accessible, to have good science, good information, and good practices to turn around a life from one of fatigue, low energy, fear of missing out, to one of clarity, energy, and focus. All right, as always, if you like these videos, be sure to subscribe. Pass them on to your friends if you find that these are helpful, and leave some comments because I'll be sure to respond to all of your comments personally. And as always, be well, get untired, and I will see you all in another video. Blessings and be well.